So let's talk about speech and swallowing dysfunction in Parkinson's disease patients. It's one of those things that sometimes you go to the doctor and you have a lot of things on your list and you might not get to that point on your list, but it's absolutely critical. And the reason why it's critical that you talk about speech and swallowing with your Parkinson's disease specialist or your neurologist or your primary care doctor is that it may be a correctable issue. Now, let me give you an example. I have several patients in my practice that when they come in, they talk very softly, and we call that hypophonia. And neurologists like to give names to all these different disorders. And so this very soft speech we call hypophonia. So if you read about it in a medical journal or you see that term on a Parkinson's disease website, you'll understand what they're talking about is a softening of the voice. And this happens naturally in Parkinson's disease patients. Now, there's always a silver lining, right? There's always things that are there that if we understand them, we can take advantage. And the silver lining for the hypophonia or the soft speech in Parkinson is that we can rehabilitate it with speech therapy. Now, what happens in Parkinson's disease is that as you have symptoms over the years, your speech will soften. And this is normal. And you should understand this is a normal part of the disease. Now, the Parkinson patient perceives their speech to actually be normal, even though it's very soft. And this causes a lot of conflict between the caregivers, the friends, the people trying to talk to the Parkinson patient on the telephone. And so you can understand that if you believe that your speech is normal, but it's very soft, this can create a problem. And we call that an anosognosia. So remember I told you, neurologists like to give names to things. And nos is the Greek word for knowledge. And a means not knowing. So it's an anosognosia. You're not actually aware that your speech is soft. And so it's important that as you get into speech therapy, and there's a particular type of therapy called the Lee-Silverman techniques that are very helpful for Parkinson patients, that you get the volume of your speech up. And sometimes when I'm sitting with a patient, I ask them to count to 10, and they do it very softly. 1, 2, 3, 4, 5. You can probably barely hear me, and I say, bring the volume of your voice up. And they go, 1, 2, 3, 4. And I say, no, yell at me like you're angry. 1, 2, 3. And actually, when you're yelling, when you have Parkinson's disease, you may actually be bringing that voice back to what would be a normal voice volume for conversational tone. And so you're not aware that your speech, that the volume is that low. And so providing that reminder, providing that cue to try to articulate, to try to bring the volume of the voice up can be very helpful. And so having the caregiver understand that and the Parkinson patient understand that, and receiving these Lee-Silverman voice therapy techniques to try to bring the volume of that voice up can make all the difference in the world. And you can understand to get things done, you need to be able to effectively communicate. And so it's very important. And so it may not be the top thing on your list, but you'll find out, I think, if you keep an eye on it and softening of your speech is becoming a problem, that there's something that can be done and it can really improve the quality of your life. And so thankfully we have some treatments that we can put into place.